Adding the opioid epidemic, Boone County's judge executive paid a visit to our nation's capital to discuss this matter. And Gary Moore is kind enough to join us this morning to talk about why this trip was so important. And I think I know why it was so important is that Boone County is not exempt from what has been really a scourge on our area. And that has been this really dramatic and puzzling upsurge in the number of overdoses.
Well, that's true, John. We have been facing this challenge really for the last 5-6 years. And if you'd told me when I became judge executive that we would be dealing with heroin in the suburban and rural areas of northern Kentucky, I wouldn't have believed it, but it's there. And it's because of the opiate addiction and the transition to heroin that we're seeing.
Yeah, and it's such a problem here locally. It's really a problem nationwide, and I think that's why they had this roundtable discussion in Washington, D.C. Tell us about how it is you were invited there.
Well, I've been elected as a national leader of all counties in the U.S., the National Association of Counties, and there were about 4 of us from county government at the White House roundtable. There were also officials from state government, attorney general's offices, health departments, and many from the federal level. So I was invited because of my role at NACO, but northern Kentucky really is one of the epicenters of this challenge, unfortunately.
Tell us about what was discussed there. I guess some best practices kind of things,
yes.
Maybe some new tactics for tackling this. Tell me what you found out.
Well, I was pleased to hear that the federal government is shifting and giving more local control to the states and to county governments. In the past, the rules were so stringent that if you needed Medicaid dollars, for instance, to deal with a certain component of this treatment, the flexibility wasn't there.
Yeah.
And the purse strings have been loosened. So state governments funneling on down to counties, to health departments, is more available than it used to be. We're finding that the treatment for these individuals is really a comprehensive treatment plan. It's not just the drug treatment, but it's finding a job, it's finding housing. When these individuals are introduced back into the general population, they need a wraparound service to be able to succeed. And we talked a lot about that at the roundtable.
Yeah, is there anything that's happening here locally that you've seen, in Boone County perhaps, that gives you hope that this thing can be tackled?
Well, I think the best example of success is really over in Kenton County. Their substance abuse treatment program that's happening inside the Kenton County Jail is getting national acclaim.
Sure.
And we're moving forward with replicating what they're doing there. But treatment inside the facility leading up to a lot of tools that the individual need once they're released to be able to succeed. So that's probably the model program here in the greater Cincinnati region.
Okay, we only got a few seconds left. If you had to tell the general public something about what's happening with this epidemic, hopeful?
Very hopeful, but it's shifting. We know that it's more about mental health and substance abuse, not just heroin. We need to be aware that there'll be another drug of choice. We have to be nimble and ready to move quickly.
All right, Gary Moore, the Judge Executive of Boone County, thanks so much for coming in.
Thank you.